Does a vacuum erection device actually make your penis bigger or thicker? I'm Dr. Emily Carter, and today we're going to talk about the real science behind these so-called penis pumps. Let's be honest for a second. Every man, no matter his age, has wondered if there's a way to get back what time slowly takes away. Not just strength, not just energy, but that quiet confidence, the feeling that your body still listens to you. That's why these penis pumps caught so much attention. They promise to make you bigger, stronger, younger. But here's the truth no one tells you, especially if you're over 60. It's not about size, it's about circulation, confidence, and connection. And if you've ever felt embarrassed, frustrated, or just curious about what really works, stay with me. Because in the next few minutes, we're going to separate medical fact from marketing fiction and help you understand what these pumps truly can and can't do for your body. Now, before we go any further, let's clear up what this thing actually is. Most people think a penis pump is some sort of gimmick, a tube, a handle, a promise. But in medical terms, it's called a vacuum erection device, or simply a VED. And it's not new. In fact, doctors have used them for decades to help men with erectile dysfunction, long before those little blue pills even existed. Here's how it works in plain language. You place a soft plastic cylinder over the penis. When you pump out the air, it creates negative pressure, a gentle vacuum that pulls blood into the erectile tissue, the corpora cavernosa. That's the same blood flow that normally creates a natural erection. Once it's full, you place a snug ring at the base, called a constriction band, to keep the blood from escaping. Think of it like closing a small valve to hold the pressure steady. The result? An erection. No pills, no injections, no nerve signals needed. And for men over 60, especially those with diabetes, heart issues, or nerve damage after prostate surgery, that's powerful. Because even when the body's internal system doesn't respond like it used to, the device can still help you function. But before you rush to buy one, let's talk about what the science actually says. Not the advertisements, not the promises, the real measured results. So what does science actually say about these devices? Here's the truth. The research isn't done on young guys chasing a few extra centimeters. It's done on men who've been through prostate surgery or who struggle with nerve-related erectile dysfunction. After prostate removal, many men notice something they're not warned about: penile shrinkage. On average, they can lose anywhere from 0.5 centimeter up to 4 centimeters of length within the first year. Why? Because without regular oxygenated blood flow, the erectile tissue begins to stiffen and scar, a process doctors call fibrosis. It's like a muscle that hasn't been used. Over time, it weakens and shortens. But when these men use a vacuum device regularly, just 5 to 10 minutes a day, the results are different. The fresh, oxygen-rich blood keeps the tissue flexible and alive. One study tracked 74 men for a full year. They used the pump for 5 minutes twice a day. After 12 weeks, the group that used the device lost far less length than the group that didn't. Some even gained a few millimeters back. Another study looked at men who used the pump after nerve-sparing surgery, meaning their sexual nerves were still partially intact. Among those men, only 23% saw any decrease in length or girth, compared to 63% of those who did nothing. There's even data from men preparing for penile implant surgery, where the goal is to get the largest, most natural fit possible. Those who used a vacuum pump daily for a couple of months before surgery gained roughly 0.8 centimeters in stretched length. Let's step away from the science for a moment and talk about something deeper, because when most men look up penis pumps or size boosters, it's not really about size, is it? It's about confidence. It's about wanting to feel like yourself again. to wake up, look in the mirror, and see the same man you've always been. And here's the thing. Aging changes the body, yes, but it also changes how we see ourselves. When your energy drops, when your strength fades, or when things don't respond the way they used to, it's easy to start feeling less capable, less attractive. That's not vanity, that's human. Mark, a 67-year-old retired teacher, once told me, "I didn't care about looking bigger. I just wanted to feel like a man again." He wasn't chasing youth, he was chasing connection. And that's what most men want after 60. Not to impress, not to compete, but to connect. To feel close to their partner again, to know they still have control over their body, and to keep that spark alive. Now that we've talked about how these pumps actually work and why men turn to them, let's tackle the big one, the myths. Because let's face it, the internet is full of promises. Gain 3 inches in 30 days. Get rock-hard results overnight. Clinically proven to increase size, guaranteed. Sounds exciting, right? But here's the truth. No credible medical study supports those claims. The only proven use of a vacuum erection device, the only one doctors recognize, is to help men with erectile dysfunction or those recovering from prostate surgery. It's a medical tool, not a miracle gadget. The European Association of Urology, one of the world's top authorities in men's health, reviewed every study they could find. Their conclusion? Data on vacuum devices for penile elongation are scarce, and no significant improvement in length or girth has been proven. In plain English, there's no strong evidence that a pump can permanently make you longer or thicker. And if you ever see a company using words like guaranteed results or scientifically proven growth, be careful, because that's not science, that's sales. The real medically verified benefits are much simpler. It helps maintain blood flow, it prevents tissue scarring after surgery, and it allows men with damaged nerves to still achieve erections. So if the pump alone doesn't really make you bigger, what does work? The truth is there's no single shortcut, but there are ways to naturally improve circulation, hormone balance, and function, all of which affect performance where it counts. Let's start with what doctors already know helps. Think of it like physical therapy for your body, but for the penis. It uses gentle, sustained stretching to encourage tissue growth and flexibility over time. Some studies show small but measurable gains when used daily for several months. The key here isn't force, it's consistency. Just like with exercise, steady effort creates gradual improvement. At the end of the day, this conversation isn't really about pumps or devices. It's about you, your body, your health, your confidence, and the quiet belief that you can still feel strong even as the years go by. You've spent a lifetime taking care of everyone else, your family, your work, your responsibilities. Maybe it's time to take care of yourself. If a simple tool helps you stay connected, stay confident, and stay alive, then use it. But use it wisely. Not because of what a salesman promised, but because you understand how your body works. Remember, the real secret isn't in the device. It's in your discipline, your mindset, your health. Because confidence isn't about being 20 again. It's about owning who you are right now.